Hi everyone, welcome back to my channel. For those new here, hi, my name is Jenny. I am a family medicine physician and a mom of two. And so today I want to talk to you guys all about postpartum stuff, like postpartum life, hair changes, hair loss, skin changes, body changes, incontinence, sexual intercourse, all that stuff that people don't necessarily talk about, and from a doctor's perspective. So if you are interested, then keep on watching. But before we jump into it, I would love you guys to subscribe, join the family. I love this channel for women empowerment, inspiring you to be your best and do your best and learn from each other. So if you like all that, then subscribe, turn on the notification bell so you don't miss a video. If you're not about that life, then what are you even doing here? All right, so let's get started, and we'll just start from the head all the way down to the feet. Let's start with mental health, because postpartum depression is actually very prevalent in society and we don't talk about it enough. Postpartum blues are when you feel sad over the next few weeks after delivery, but postpartum depression can be very significant. It can last like over a year. I know I suffered from postpartum depression after the birth of Wyatt. I looked in the mirror and I didn't recognize myself. My breasts were enormous. I didn't fit to any of my clothes. I didn't recognize my body. Mentally, I was not happy. Not only did I not love myself, I felt like the relationships around me were suffering. I didn't enjoy the things that I used to love. And so definitely please talk to somebody if you feel depressed, because sometimes, or a lot of the times, we blame ourselves when it is not necessarily our fault. So a lot of the times I know it is hard to tell, especially with a newborn and you're really stressed out and, you know, like, is this insomnia due to the fact that I have a new kid that's waking me up all the time, or am I tired all the time because I'm depressed? So definitely talk to your doctor about it, because mental health should be talked about more and should be more socially acceptable. Next, let's talk about postpartum hair loss. It can be significant. Like, Stan thought that I was literally dying because I was losing so much hair. Like, literally there was hair everywhere, all over the floors, in our clothes, in our food. So the medical term for postpartum hair loss is telogen gravidarum or efflorarum. This is when the lifespan of your hair is prolonged during pregnancy due to the circulating hormones. After delivery and after the body regulates, you start losing your hair because the hair cycle naturally ends, and that is when you have lots and lots of shedding of your hair. So I'll put in clips of this. I'll recommend you fast forward if you kind of don't like gross things, but I think it's a little bit gross. But here's a video from my Instagram stories. What I'm going to show you is kind of gross, so if you don't like kind of gross things, just skip through the next two stories. So I'm literally losing all my hair, guys. Oh my gosh, this is so much hair. They say it's normal. So your baby hairs do grow back, but it's a process. The peak of when you lose hair is about 4 months, and it can take up to a year and longer before you actually start seeing regrowth. So if you guys can see my hair now, like I have this hair that this is regrowth, but there's also smaller ones like up here in the front that's regrowing. If you compare it to my previous video, like, you can tell that all this was missing, and now my hairline is coming back to here. So don't worry, your hair is gonna grow back. Some of the things that I personally did, because my hair was so crazy, pulling your hair back can cause worsening of the symptoms just because you're pulling on your hair. Something like putting it down or braiding a loose braid can actually help. Snatch ponies are not good because it pulls or breaks the hair. And I was horrible at that. Like, my hair at work is always in a tight bun up on top of my head, and so I was not doing myself any favors. I also put makeup on the area until the hair grew back, especially in pictures. This worked really well. I use this brush for some reason. It works really well. It's the MAC 227 and I use black. I either used black eyeshadow or basically eyebrow powder and literally went ham in there and went to town in there and covered it up nicely. And yeah, so you can do that until your hair grows back. Next, let's move on to skin changes. When you're pregnant, you notice that your skin probably has all these dark spots. I personally have freckles, and I definitely got more freckles and darkening of the freckles when I was pregnant. People can get melasma, which is dark spots on their skin, or pregnancy spots. This is also due to hormone changes. Luckily, after you give birth, these skin changes clear up. And what you can do to help them like not get so dark is actually sunblock. I personally get so much hyperpigmentation in my skin with scars, with like acne scars or anything like that. So prevention is sunblock. Moving down to the neck and maybe the axilla, armpit. Sometimes you can get like darkening lines in the folds. That in medicine we actually called acanthosis nigricans. It can be a sign of insulin resistance. I personally had gestational diabetes and I definitely saw like darkening of my axilla when I was pregnant with Wyatt. Like I was putting up my hair one day and I was like, ooh, is that because I didn't shave or is it just darkening of my skin? And it was definitely a lot darker. After pregnancy, those things lighten up. Obviously check with your doctor if you have gestational diabetes. You need to be checked like every 3 years for diabetes because you're at more risk. Make sure you don't have diabetes afterwards. Now let's move down to the breasts. You also have skin changes in your breasts, like the areola. It can become a lot bigger during pregnancy, and it's not a lot of things that women like to talk about, but it can be like provoking a lot of self-consciousness. Luckily, this also changes with hormone changes. So once you finish your breastfeeding journey, it is likely that it will become smaller. Not necessarily the same as pre-pregnancy, but it does reduce in the intensity of the color and the size. Your nipple also changes with pregnancy and with breastfeeding. So in the beginning of your breastfeeding journey, your nipple can be bigger, and throughout your breastfeeding journey, after hormone changes, it can become smaller. So for those of you who are pumpers who need to go to work and are away with baby and or pump exclusively, and you notice that you're responding less to the pump, it might be that your nipple size has changed. Usually changed smaller, so you need a smaller flange size. Try that out. One of my friends said that she was an exclusive pumper, and then she was just like, I don't know why for my second baby the same pump that I was using isn't working anymore. And I was like, try to go down on your flange size, and then voila, it was like magic, and she was able to pump. And now with demonstrations, because I know you guys love demonstrations. Imagine this is a pre-pregnancy boob. Look how much the skin is like tight, and if I hold it like this, it stays like pretty perky. Well, this is probably your breast during pregnancy. It gets bigger. This is your breast after delivery. You know, it can get engorged or when the milk comes in and stuff. So milk comes in, baby feeds, and then you get engorged again, you know, because overnight or baby doesn't empty you well, and then baby feeds, and then you get more milk, and then you get engorged again. Who knows, maybe you have mastitis or a clogged duct, right? And then baby feeds, and then again, you know, you get engorged, baby feeds, engorged, baby feeds. And so even though after about 4 to 5 months, I would say some people stop feeling engorged. Doesn't mean that your body is not producing milk anymore. You're possibly still producing the same amount of milk. You just lose that sensation of engorgement because your body regulates. Anyways, so now that you finish breastfeeding, your boob's like this. Very sad and droopy. And no longer, you know, perky. So this is a representation of my breasts. I'm so sad. Yeah, I don't know why. I just wanted to demonstrate that for you. Nothing you can do about this, unfortunately, except learn to love the fact that you were able to feed a beautiful human being and nurture them. There are surgeries where you can, you know, take out the excess skin and lift the breasts, but that is surgery. I was reading some things where you can like tighten the ligament or something like that and pull the breast up, but unknown success rate from what I was reading. But yeah, I'm still trying to love my body here. So let's do that together. Love our bodies. All right, now let's move down to the abdomen and, you know, stretch marks. Let's talk about them. I blame my mom for my stretch marks because they are genetic. And so I knew that I was going to get stretch marks because I had stretch marks on my thighs from when I was growing up as a teenager. But you also have to think that a lot of people, even though they have stretch marks from their parents, don't have stretch marks on the abdomen. Like my sister doesn't have stretch marks. And it is due to the growth within the last trimester, and the rapid stretching of your skin can cause stretch marks. We can try to possibly slow down that or urge stretching of the skin with moisturization. So things that you can do for your stretch marks besides prevention, now that you already have it: surgery, cutting out the skin and then pulling the skin from the top of the abdomen down, and then sewing that back up together. Or there's also some microneedling that people can do to increase the production of collagen. I'm gonna try this amylactin lotion. It is originally used for keratosis pilaris, which is the bumpy skin on the back of your arms. It used to be prescription, but now it can be found over the counter. I'm thinking that, you know, if it can help bumpiness in the arm and hyperkeratosis, which is skin, I'm possibly thinking that it can moisturize my abdomen to make it look a little bit better. This has no scientific evidence. No one told me that this is going to work. I just have it laying around because I use it for my arms. Might as well put it on my stomach. So I'll keep you guys updated on how it goes or if it looks any different. So yeah, I'm also trying to get back into shape to see, like, if I'm in shape, then maybe it wouldn't look as prominent, but who knows. I'm deathly scared of surgery, and so these are the things that I'm doing to try to have me feel better about myself. Some things that you can help prevent significant hyperpigmentation of your skin is, once again, sunblock. I feel like a broken record now, but an ounce of prevention weighs more than a pound of cure. Did I say that right? An ounce of prevention is better than a pound of cure. All right, now let's move on to intercourse. With a lot of pregnancy changes and the trauma of delivery, there could be anatomical changes as well. So here you have the pelvis area, and this right here is the vagina. This is your cervix, and this is your uterus. And this is your bladder, this is your urethra, and this is the rectum. When you have any sort of prolapse is when you have falling of any of these structures into the vagina or into the rectum. Some people have prolapse, mild, moderate, severe. It just depends on your particular body. But some may notice that sexual intercourse can feel different once after you've healed up and all that stuff from delivering baby. positions that felt good before might not feel as good now. I want to tell you that that can be normal. Some things that are not normal, fevers, significant abdominal pain, foul, smelly discharge, things that you should talk to your doctor about. So my recommendation, after ruling out all the big, bad, ugly, and scary things, is to getting to know your new body. Also, remember this pelvis and the stretching that occurs during pregnancy and hormone changes. And I told you guys I had a lot of pain here that, you know, when you go back and forth, it really hurt. Sometimes somatic dysfunction in the pelvis area can also cause pain with intercourse or with walking, especially if this pubic area is not aligned. Along with pelvic floor exercises, there are some stretches that you can do to help realign this pelvic area at home. I'm gonna need to wait for Stan to come home to show you a demonstration.
Mommy.
Okay.
About me.
You can lay next to mommy. Lay down. Okay. All right, so you're gonna lay down on your back and you're gonna squeeze with your partner's hands in between your thighs. So squeeze 1, 2, 3, 4, and relax. And then when you push out, the space in between your knees are supposed to be the same too. So 1, 2, 3, 4, and relax. Good. And now you widen up a little bit. Again, push in. 1, 2, 3, 4, and relax. And then out. 1, 2, 3, 4, and relax. Good. And then now you're gonna have your partner put his whole forearm or her forearm in between your legs and go 1, 2, 3, 4, and relax, and out. And the whole time, and out. Yeah, out. And the whole time that you're doing this, you want to keep your pelvis down on the floor. Like when you squeeze, you don't want to lift up like this, okay? So you try to keep your hips on the floor. And squeeze in or out, yeah? And that's it. And this is to realign your pelvis. All right, all done.
Come here, I'll try on you wipe. Come here.
Ew, you need to change your diaper. Now let's move on to peeing. Urination. Let's move on to urination. After you deliver your baby, even though your doctor says you didn't tear or you may have torn, there are also some things that are called, like we call it skid marks. You know, like when you fall and like scrape your elbow and it stings and it really hurts. When the doctor says that you didn't tear, means that you didn't have a perineal laceration that needed repair with sutures. But you can still have these skid marks on the side of your vagina that can cause significant pain and stinging when you urinate. This is your best friend, because once you have any scratch in the skin, like the acidity of your urine can really like sting, if you know what I mean. So what I do is that I fill this up with water prior to urinating, and then before I pee, you know, squeeze it into that area and then start urinating. I remember it was so bad with Wyatt that I literally had to sit in a tub to pee because it was just so painful. So remember, even though they said you didn't tear, it can still mean that you have some, you know, skin wounds that can be painful when you pee. Next is incontinence. It is very common for women to have incontinence after giving birth because the pelvic floor muscles have been stretched. The nerve that runs through there could have been stretched. So I remember after my first pregnancy or delivery with Wyatt, I was pushing literally from 8 in the morning and he was not delivered until 3:30 in the afternoon. So I was literally pushing the whole time. And afterwards I was like, do I have a UTI? Like, I feel like I'm peeing weird. Like, my stream isn't as hard and I'm trying to push and it's like trickling out. It's like really weird. And so there's a lot of edema and, you know, stretching of that area, and it takes some time for the nerves to heal and go back to normal. But there are people who have longer term incontinence issues, like when they sneeze, some urine comes out, or when they're walking, some urine comes out, like stress incontinence. So there are things that you can do to help that, which are pelvic floor exercises, or more known as like Kegels. I learned this from a urologist, and she said that once you feel like you have this urge to pee, stop, hold it, do a Kegel until the sensation goes away, and then go to the bathroom and urinate. This will help train your bladder and your pelvic floor muscles to be stronger. So yeah, try that out, see if it helps. Talk to your doctor about pelvic floor physical therapy to see if they can refer you if incontinence continues to be an issue. All right, and now let's talk about varicose veins. So veins anywhere in your body have one-way valves. So when the blood is pushed back up, it goes up and it can't come down over the valve. What happens during pregnancy is you have increased amount of volume within your blood, and you have this baby sitting in your pelvis, preventing a lot of the fluid from coming back up. It's like blocking, and that can then mess up the valves because stretching of the vessels and the valves doesn't close all the way, and once those valves are, you know, destroyed, it doesn't really heal itself. And that's when you get varicose veins. Some prevention that you can do is wearing compression stockings during your pregnancy. I know, again, with the prevention, some things that you can do that once you already have varicose veins, continue to wear compression stockings. But there are surgeries that you can do to basically strip those veins. Yeah, I hope you guys enjoyed this video. I really enjoyed making it and basically talking to you guys about it. I'd love to answer any of your questions you have in the comment section below. Also, as a disclaimer, I can talk about things in general, but I cannot give out personal medical advice. And so if you have any concerns at all, please, please, please talk to your doctor, your primary care doctor, or your OBGYN about this, because there are certain things that I talk about today that can be mimicked by, you know, actual disorders. Like thyroid disorder can be confused as either depression, anxiety, hair loss, weight loss or weight gain, all those things. So please check with your doctor if you have any personal concerns. All right. Thank you guys all for watching. I enjoyed so much making this video. If you haven't already, please subscribe, give this video a thumbs up, and I'll see you guys next week. Peace.